Esophageal cancer is an important disease in our country and even worldwide now, and there are very strong ties between esophageal cancer and gastroesophageal reflux disease. Over the last 20 to 30 years, esophageal cancer has been increasing in the frequency with which we see it, and there has to be some reason why that's occurring. As we look more closely at it, the rise in adenocarcinoma of the esophagus, which is now the more common form in the United States, the rise in incidence of adenocarcinoma of the esophagus has followed the rise of gastroesophageal reflux disease in our country. Although esophageal cancer is not one of the more common cancers, such as colon cancer, it takes almost as many lives, around 18,000 a year in this country, as does colon cancer. Colon cancer is simply easier to treat. But when you look at all of the cancers taken together, esophageal cancer is growing in numbers faster than any other, and there really has to be a strong explanation for that, and it seems to be the markedly increasing risk of gastroesophageal reflux disease poses. Gastroesophageal reflux produces a change in the lining of the esophagus called Barrett's esophagus. Barrett's esophagus then is very much more likely to develop cancer in that tissue. When I say Barrett's esophagus, I'm referring to a change in the lining of the lower part of the esophagus that now is much more sensitive to development of cancer. We know that there's a very direct connection between the two. In fact, most patients who have their esophageal cancer removed, we find that there's Barrett's esophagus still there. There are other lines of scientific proof that show that those two things are very clearly related. Esophageal cancer is a very difficult problem to treat. For one thing, reflux is very common, so there's a large number of patients who we need to be looking at because they are at risk, and the longer they have had reflux, the more severe it is, the more likely they are to develop Barrett's esophagus, and the more likely they are then to develop adenocarcinoma of the esophagus. It's important that we understand ways to prevent carcinoma of the esophagus because it's so difficult to treat. The surgery for esophageal cancer, when it can be performed, it's a pretty risky surgery as those things go, and it leaves the patient with changes in lifestyle because we have to make modifications of their diet and the like. But the real important factor is that far too many patients with esophageal adenocarcinoma are not candidates to have surgery, and in general, surgery is the best way to cure adenocarcinoma of the esophagus. Typically, patients receive treatment with chemotherapy, radiation, and then undergo surgery, but unless we're able to do those three things together, we don't give the patient as good a chance of surviving the disease. Unfortunately, even in the best hands, survival is not great. Very talented university programs with lots of experience in carcinoma of the esophagus may still only have 5-year survival rates that are no higher than about 60%, and that's being very generous. So it's a difficult problem to treat. It requires that we do aggressive surveillance to identify patients at risk, and by that I mean those people with reflux who have developed Barrett's esophagus. Once the Barrett's esophagus looks like it is heading toward the development of malignancy, then there needs to be some more aggressive intervention. Once the patient develops esophageal cancer, that's now in a different category. It's a difficult problem to treat, but fortunately, with a combination of effective chemotherapies, radiation, and aggressive surgical treatment, we're able to produce good survival and save many lives that way.